Hello, my name is Carolyn Palma. I'm a physical therapist at Cooperman Barnabas Medical Center in Livingston, New Jersey. I am one of the supervisors of the rehab department. I've been a physical therapist for 35 years, and I've been at Cooperman Barnabas for 11 of those years. I'd just like to talk to you today about the effects of stroke. If the right side of the brain is affected, the left side of the body will be affected. If the left side of the brain is injured, the right side of the body will be affected. So, with a right brain damage, there will be weakness or paralysis to the left side of the body. Visual and perceptual deficits may occur, meaning that the person may not be able to determine how far away or how close objects are to them. They may be unaware of their deficits, and there may be a one-sided body neglect, meaning that the person does not recognize that they have two sides of their body. They may just ignore the left side, which can cause injury. There may also be memory deficits or impaired thinking, such as impulsivity, which means that the person may move quickly or think that they can do things that they really can't do, causing safety issues. If the left brain is damaged, there may be weakness or paralysis to the right side. Speech and language deficits may also occur, as well as memory deficits and visual perceptual deficits. Taking a look at the image of the brain here, you'll see that there are different parts of the brain. The top part is what we just talked about in the green, blue, and orange. There are other parts. Right down at the bottom, that little piece that's sticking out at the bottom is called the brainstem. And if this is affected, both sides of the body will be affected, and the person may be unable to speak or move below the neck. There's also a cerebellum. That's the little piece, the gray piece on the bottom there that's in the back of your head. If this is affected, it may cause balance and coordination issues, dizziness, nausea, vomiting, or visual changes. The physical effects of stroke may either be weakness and or changes in muscle tone. For 75% of those with stroke, they will experience weakness or paralysis. This may include one or both sides of the body and can cause balance and coordination problems and an inability to isolate movements. This will cause problems with picking items up and maneuvering them in their hands or with walking. There may be changes in muscle tone. The muscles may become flaccid, and that means that they are loose, relaxed, and unable to move. They may also become spastic, where they get very, very tight. This will also cause problems with function. There may be also sensation changes, a loss of feeling in their limbs, their face, or their trunk. They may lose their ability to sense things when they touch them, and they may not be able to discriminate between hot and cold. There may be an inability to recognize objects by touch, meaning that if you put an object in your hand, you normally can determine what that object is. But after stroke, this might be difficult. There may be numbness of certain areas. There may be an inability to determine where the limb is in space. And there may be limits in function, self-care, and patient safety as a result of all these changes. Visual changes can also occur. People may experience double vision, loss of one side of vision, and there may be a blind spot. And as we said previously, there may be neglect, a lack of awareness of one side of the body where the person may be not looking for or looking toward that affected side. This will limit function, self-care, and patient safety. There may also be communication problems, a difficulty understanding conversation, an inability to form words or sentences, and difficulty reading or writing. Cognitive changes can also occur, and they will include an impairment in judgment and decision-making, impairments in attending to daily tasks such as making phone calls, texting, taking medication, etc. No change in intelligence may occur at all, but difficulties in math and formulation of thoughts will. So because the person is not able to do math or think of things or speak clearly, that does not mean their intelligence level has changed. They may have a difficulty following directions, and there may be memory loss. In addition, there may be behavioral or emotional changes of fatigue, loss of emotional control with sudden laughing or crying or anger that is not characteristic for the person. And depression is seen in 1/3 of patients after stroke. I hope this information is helpful for you and that you keep in mind to look out for signs and symptoms of stroke. Thank you. So now we're going to talk about physical and occupational therapy evaluation and treatment in stroke. Physical and occupational therapists work together in evaluating people after they've had strokes. Members, the OTs and PTs are members of the multidisciplinary team. They consult with the patient to determine what the patient's goals are for treatment. These may include increasing strength, improving functions such as bed mobility, walking, activities of daily living such as eating, dressing, and showering, or activities that the patient enjoyed doing prior to their stroke. They work together to determine a plan of care to achieve the patient's goals, and this all begins very soon after the patient has had a stroke. First, the therapist will take a medical history, both past and present. They will determine how the patient was able to move, to walk, and carry out activities of daily living, such as bathing, eating, and dressing prior to the stroke. They will also find out from the patient and their family members how the patient's home is set up, what physical barriers there are, such as stairs, and if there are others who are supportive in the home. They will assess the level of pain and the location of pain and what the patient's goals may be. The evaluation continues by assessing the patient's ability to communicate, what the ability is to understand and participate in conversation, and what that person's reading and writing abilities are. Cognition is also assessed by looking at the patient's awareness of self, place, time, and situation, and what their ability is to attend to tasks of daily living, such as making phone calls, texting, taking medications, etc. Problem-solving skills and formulations of thoughts are also assessed, as well as the person's judgment skills and safety awareness. The evaluation goes on to assess the patient's reflexes and circulation, which consists of taking vital signs and checking for skin breakdown. Sensation and the person's ability to determine between hot and cold and to feel what they touch is assessed. They will also be assessed to see if they are able to determine where their body part is in space and if they are able to determine what an object is by holding it in their hand. They will be assessed for the neglect or lack of awareness of one side of the body, and if that is occurring. And vision will also be assessed, whether there is double vision, loss of vision on one side, or a blind spot. The evaluation continues and includes muscle testing to determine the strength of each muscle and to assess the changes in muscle tone. A flaccid muscle may be much more loose and relaxed than normal and may be unable to move, where a spastic muscle may be just a little tight or much tighter than it normally is. The ability to isolate movements, for example, moving a hand to right without moving the whole arm, will also be assessed, as well as lower extremity, whether the pieces of the lower extremity, such as the foot and the knee, can act separately or if they will all work together. Balance and coordination is also assessed. And the evaluation continues and includes functional abilities that the patient may be having issues with, such as bed mobility, transfers, sit to stand, standing, walking, dressing, bathing, and eating. Further evaluation and further recommendations for further care may include assessing the patient for an assistive device which may be needed, such as a cane or a walker, splinting for a leg or foot to assist with walking, splinting for the hand to support and to prevent loss of function, and referral to members of the multidisciplinary team, such as visual specialists and physiatrists, which are doctors of physical medicine, that may be needed. So we're going to move on to the interventions that will take place for patients after the assessment. These interventions are coordinated between PT and OT, the physical and occupational therapists, and they will be customized and progressed as appropriate to make sure that the patient is progressing as they should. This will include hands-on care, and the overall goal is to improve that person's function and quality of life. Functional training will occur that is specific for a task and may include bed mobility, transfers from one surface to another, sit to stand movements, standing, walking, dressing, bathing, eating, writing and picking up objects, or it might be something that the patient enjoyed prior to their stroke, such as golfing or playing tennis. To achieve their goals, balance and coordination activities may be incorporated into treatment, as well as strengthening exercises and mobilizations of joints that are tight. Positioning of limbs is very important for prevention of secondary problems, such as swelling, shoulder separation, skin breakdown, joint tightness, and loss of mobility. So patients and their family members will be educated on the importance of positioning and how to place the patient when they're sleeping or in bed to improve upon and prevent these secondary problems. Sensory techniques will be employed also, if necessary, and they will include texture discrimination, tactile object recognition, position sense, and biofeedback. In addition, activities for improving cognition will be used if necessary, and also including the provision of splints if necessary, and the education will always occur for patient and family members, which is a primary goal of physical and occupational therapists, to make sure that the patient and their family members know what is occurring, how they can help, what they can do to improve upon their own outcome, and what they need to do on their own outside of therapy. Other members of the healthcare team may be referred to as needed. So let's just talk a little bit about the detriments of falls. Injuries during falls are very severe, can be very severe, and they include fractured arm, leg, or spine, paralysis, lacerations and bleeding, dislocations, sprains, functional decline, brain injury, and even death. So we do everything we can to educate the patient and their family members on the importance of fall prevention and the importance of being very careful with movement and making sure that somebody is with them if needed for assistance at all times. So making your home safe is very important, especially after a stroke or at any time in life. You want to clear your areas where you walk to avoid tripping. Remove all throw rugs or use adhesive on all rugs to keep them in place so that they become less of a trip hazard. Put non-slip mats in the bottom of the bathtub or shower to prevent falls in the shower. Have handrails on all stairs and make sure that they are used when you are going up and down the stairs. And install grab bars if appropriate in your shower and next to your toilet to prevent falls and to assist with movement. The house should be well lit to also prevent falls, and items that you use frequently should be kept within reach so you don't have to reach far up or far down to get to them. Avoid walking in bare feet or slippers and use comfortable shoes with no heel and rubber sole at all times to avoid slipping. The correct use of an assistive device is very important and should be used as instructed by your therapist. Sometimes it's tempting not to use your assistive device when you feel you're fine, but it is always recommended that if the therapist has recommended that you use the assistive device, that it be used to prevent falls. And as always, whenever you need assistance, make sure you wait for the assistance as you've been instructed prior to moving to prevent falls. Thank you for listening, and I hope this information was helpful. Enjoy your day.